bring in Dr. Ngozi Ezike, the director of the Illinois Department of Public Health. Dr. Ezike, thank you for your time this morning. This positivity rate there in your state at record highs. Hospitalizations have surpassed the spring peak. How can these new guidelines hopefully help containment efforts there in Illinois?
Right. So as you said, all the numbers and metrics, everything is going in the wrong direction. And we hope that these additional mitigations, they're simply words on a paper. But what we're counting on is that the people of Illinois will adopt them, that there'll be near universal adoption to implement these mitigations. And I think if implemented, we can flatten this curve. We can turn things around. We can interrupt disease transmission and stop sacrificing our healthcare workers who've already paid more than their due. We need to give them a hand so that we can stop having the onslaught of patients that are going in for COVID-related issues.
This latest round of guidelines, as you know, does not include a stay-at-home order, but Governor Pritzker did warn that another order may be required. Is that something you think is needed soon?
Well, it really depends on the people of our state, and we're really counting on the residents to do what's necessary so that we don't have to go to that option. So we have a lot of power. I keep telling the people of Illinois, like, we are the author of this story, of this book, and we can have chapters of doom, or we can have chapters that show that we did the right thing, we used our mask, and we stayed put voluntarily so that we can interrupt disease transmission and get ahead of this pandemic.
Thanksgiving, of course, just 8 days away. You are among the folks urging people to avoid family gatherings this year. What are the potential consequences that you're most concerned about if people don't heed warnings like that from you and other public health officials?
Well, we have already seen tragic times, funerals where people have come together and people have hugged and they've kissed and they've congregated. And then those funerals have resulted in new illnesses that really turned into additional funerals. No one wants the day of Thanksgiving, the day of giving thanks for our loved ones, which are the highest things on our list that we're grateful for. We don't want that to become the situation that leads to future tragedy. So we really have to make these changes. We're not canceling Thanksgiving. We're simply saying, we're transforming it into a new way of celebrating it that we didn't do last year, that we probably won't have to do next year, but it's called for today.
We did get some potentially good news a few hours ago about Pfizer's vaccine. The pharmaceutical giant saying that the vaccine is 95% effective. They are days away from submitting it for emergency use authorization from the FDA. The company says it can produce 50 million doses this year, up to 1.3 billion in 2021. Have there been conversations between you and the governor there in Illinois about how to distribute the vaccine? Any blind spots in the state's infrastructure that you're concerned about?
No, of course, we know that the Pfizer vaccine was a little bit logistically challenging in terms of the extreme cold, the negative 80, negative 90 degrees that it had to be maintained at. But we've worked to secure ultra cold freezers that we're going to situate in every part of the state to make sure that there's no nook and cranny of our state that won't have access to this important resource. We know that we're going to be starting with our healthcare workers at first, to make sure that they are protected so that they can be ready for the journey ahead and to be able to take care of their fellow residents in this pandemic. So we're excited for the good news that's coming out. We're waiting for the FDA to give their appropriate approvals. And I think the excitement in the community is growing that there might be a closer end in sight with the availability of a very effective vaccine.
It was just a few weeks ago, Doctor, that you shared this very human moment with your state and really all Americans when you got pretty emotional and candid at a COVID briefing that you were giving there in Illinois. What is the overwhelming feeling that you have right now at this point in the crisis?
I'm optimistic. I think there were a couple of weeks ago, it seemed like there was this marathon, but we couldn't even figure out what mile we're at. I feel like we're starting to see light at the end of the tunnel. I think we're starting to see the makings of the finish line. And so I think that gives us hope that we're not indefinitely asking people to put off all of these important family gatherings and events. We know that this is going to be a time-limited sacrifice, but that sacrifice is going to be worth it because soon we will be able to be vaccinated. Soon we will be able to get back to life a little bit closer to what we've known before.
From your lips to God's ears, Dr. Ngozi Ezika. Dr. Ezika, thank you. Thanks for all the work you're doing in Illinois. Thanks for your time this morning as well.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.